Good morning. I'm Mabel, Jong. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. Our next guest has over 25 years of experience in healthcare management. We're going to explore alternative payment methods. Eric, thank you so much for your time today. I'm speaking with Eric Haberichter, co-founder and CEO of Access HealthNet. Welcome.
Good morning.
Now, in terms of the alternative payment models, are we finding some progress made on that front?
Oh, absolutely. Both employers, I think, are demanding a change in how we pay for health care. And we specialize in episodic case rates or bundles, which are everything from lab up to very complex surgeries now, oncology, cardiology, everything in between. So employers are really demanding value. If you think about like what Warren Buffett and Jamie Dimon and Jeff Bezos are asking for, they're saying we want to have something where we know what things are going to cost, we have a predictable, quality assured outcome, and it's something that's going to be much less expensive without paying for lots of layers of administration. So you really need an alternative model. In the current fee-for-service world, that's just not how things work. So by taking away all of the layers of administration, you're able to achieve a much greater value for the patient and for the employer, and also at the same point in time, achieve greater revenue for the provider with the total cost going down. So we do see a lot of progress in that space.
So you're seeing that all the stakeholders that are involved with this are being more accepting of it and creating ways to channel that change?
Absolutely. So the real hurdle to getting that change to happen will be, of course, to get large providers to accept an alternative payment model. And we've come up with a model that is very, very provider friendly. We've standardized nationally over 1,400 episodes of care so that everyone who's working with is offering the same core services, taking the same risk, and warranting the same type of an outcome. And that makes it very easy. It's not something where it's done retrospectively, where we're taking something away, or there's still this, discussion or argument about who's going to get paid. So we're finding a lot of acceptance in that. But it did take a few years to walk people down that path.
And what do people still see as obstacles?
I think time, quite frankly. The large institutions find it very difficult to take on something new. I think everyone in the world of healthcare right now feels that they're very, very stressed. They have a lot of stuff going on, and they want to see that if they're going to invest the time to adopt an alternative payment model, that it's going to work for them. That's one. And then the other one, of course, is that every physician, I think, in the country believes they spend way too much screen time already, and that it's really taking away. They're looking into an EMR, and it's taking half their patient time away from them. So no physician, no hospital system wants there to be another step. So by taking our technology and make it integrative with the EMRs, it does not add time. So I think that's been one of the big things that's helped. But any type of alternative payment model or any new product brought into the healthcare arena that is not interoperable is going to face huge challenges because of that.
Where do you see us 5 years from now?
Well, that's an excellent question. I wish I had a crystal ball, but I do think that the change is starting to happen. There's a lot of momentum, and it's really coming from employers, I think, and patients. And we also have a millennial generation that's coming up that's going to become the big healthcare consumers over the next 5 to 15 years, who are really demanding a change in the convention. So they don't really have a great understanding, I don't believe, as most people don't, of how insurance works, but they know they want something better. And the idea of being able to shop for healthcare the way you shop for other consumer goods, I think is going to be very appealing to that generation.
And Eric, how are you finding this year's conference so far?
That's been great. Yeah, we've meeting a lot of people that we know here, meeting a lot of new people. It's very well run. I'm enjoying it very much.
All right, Eric, thank you so much for your time today.
All right, thank you.
Appreciate it. And I'm Mabel, Jong. Stay tuned. We have many more interviews to come.